Hi there. My name is Dharssi, and I sincerely thank you for your interest in joining my family practice. We're a little different from the traditional family doctor's office, and before you decide to join, I want to explain how my practice works. In a traditional family doctor's office, the doctor may work solely with a secretary and a nurse. But here, you will see that we have 3 full-time receptionists, 5 full-time nurses, a full-time nurse practitioner, and a medical assistant helping with prescription renewals. Not to mention all the behind-the-scenes staff who make sure everything gets done. As you may have guessed, I do not do everything myself, but rather I work with and lead a team of people, over a dozen, to look after a larger-than-average roster of patients. The team has grown over the last decade, but we are now, more than ever, a very consistent group of people who I hope will become familiar to you over the years. I am here every day, but you may not always see me or interact with me directly when seeking medical care. While the pandemic has changed how medical care is delivered, it has always been important to me that our patients have prompt access to care. Whenever any of our patients is looking for help, we almost always start by talking to them by phone. If you call or email the office or request help through our website, you can expect a phone call back, in a typical week, within the next 1 to 2 business days. Our cutoff time for returning calls is 10 o'clock a.m. on Monday, Tuesday, Thursday, and Friday for every typical week. If you have reached us just before that cutoff time, we will call you that day. Please note that we are not returning calls on Wednesdays or on weekends, so if you happen to reach out to us after 10 o'clock a.m. on a Friday, we will not be able to return that call until Monday. Similarly, if you reach out to us after 10 o'clock a.m. on Tuesdays, you will not hear from us until Thursday. Still, 4 days a week, we are returning all calls and emails. Sometimes we will be able to help you with a phone call from a nurse or nurse practitioner, and sometimes that phone call will lead to you being asked to come into the office for further assessment. Every day, in the morning and afternoon, we see patients in person in the office. But we will only give you an appointment for these spots once we have made sure that we can do so efficiently. It is really important to our staff and our patients that we reduce the risk of spreading infections by talking with our patients over the phone whenever possible. When you have a health concern, please do not hang on to it for too long. Let us know right away before your list of concerns gets too long or things go unaddressed. It is also helpful if you are prepared with a list of topics you would like to discuss, so that we can hit the ground running when we interact with you. When you do arrive at the office for an appointment, we ask that you not arrive more than 15 minutes before the appointment time, but also make sure that you are not more than 5 minutes late, or you will not be seen. This is in order to keep things moving for the patients booked after you. In the hallway on the 4th floor, outside our suite, there is an electronic kiosk that will let you swipe your health card to let us know that you have arrived. You can follow the prompts on the screen to provide us with further information on any possibly infectious symptoms you may have. You may have heard about how we used to run our office with more of a walk-in style, but it is important for you to know that our doors are generally locked now, except for those patients we have invited in. Please do not come to the office without an appointment. Always call or email first, or contact us through our website. It is also important to note that when you do come into the office for a specific reason that has been discussed by phone or email, we do not start new conversations while you are physically in the office. So your appointment in the office is not the right time to discuss one or more new problems. This will help us to keep things moving efficiently and smoothly. It is still required for everyone visiting our office to wear a mask. Family doctors' offices are considered at least medium to high risk settings for contracting infections. So while we are doing our best to keep everyone safe with all of the above protocols, the most important way to prevent transmitting infections is for everyone in the office to wear a properly fitting medical mask. As a side note, we also have a minimal fragrance policy in the office. So please do not use perfume or other scented chemicals prior to coming into the office. And certainly we appreciate you not smoking anything for at least an hour prior. Our office is open 50 weeks a year, usually taking a week off at the end of the summer and between Christmas and New Year's. All other weeks of the year, you can expect prompt medical attention for whatever comes up, so you can rely on us to be here. Please do keep an eye on our website, www.kdmpc.ca, as there is a lot of information there about our office protocols, and we do our best to keep it up to date. If for some reason we are not available in time to help you, please remember that the emergency room for the hospital is right across the street and open 24 hours a day, 7 days a week. Also note that we belong to the After Hours Clinic, located in the plaza on Memorial Avenue, next to Life Labs and Ben's Pharmacy. For now, the hours of that walk-in clinic are 5:30 p.m. to 7:30 p.m. on Mondays, Tuesdays, Wednesdays, and Thursdays. And they are also open on Saturday mornings between 10 o'clock a.m. and 12 noon. When you are running low on a prescription, please do not wait until the last minute. We can reliably renew your prescription within 3 business days, and generally it is best for you to ask your pharmacy to contact us to request the renewal. Please note that we cannot renew your prescription when you come in for an appointment, and if you do require anything more urgently, we do charge an administrative fee. Regarding test results, we are responsible for reaching out to you in a timely fashion if there is something abnormal to report. If your test results are normal, that will usually not trigger a phone call to let you know. But we are absolutely open to you double-checking with us, whether by email or by phone, to make sure that we got the test results and to verify that they are indeed normal. Some women who are requesting a gynecological exam or breast exam are more comfortable with a woman performing these exams. And as our nurse practitioners in the office every day, we are usually able to accommodate this. Whenever I do perform these exams myself, there is always a nurse in the room present. These days, many governmental organizations and insurance companies require medical forms to be completed to help you get access to care and benefits that you need. If you have a form that needs filling out, please scan and email it, or mail it, or even drop off the form in our mail slot. We will contact you promptly after we receive it to discuss with you the next steps. Some forms can be completed quickly. Some forms can take weeks. Governmental organizations often pay us to complete these forms, but OHIP does not pay for all forms that you might need. So after we have reviewed the form, we will contact you to let you know if there is a fee involved. OHIP does generally cover all key basic healthcare services, but some things you might need that OHIP will not pay for include the following: notes for work to say that you are sick, forms requested by insurance companies, liquid nitrogen for cosmetic skin concerns, and treating warts, unless they're on your feet or around your genitals. Having said that, the vast majority of what we do is covered by OHIP. It is important that you keep your address and phone numbers and even email addresses and health card version numbers up to date with us so that we do not have trouble contacting you when the need arises. I would like to quickly talk about some extra services that are available to you that you might not know about. As a patient of this family practice, you would also be able to use the Kuchiching Family Health Team services, generally provided locally and spanning mental health, diabetes, foot care, heart function program, geriatrics, dietitians, pharmacists, health coaches, and even a musculoskeletal team that can help with neck, shoulder, and back pain. All of these services are covered under OHIP for you. Our patients do not have access to the walk-in clinic at 119 Memorial Avenue, where the Family Health Team is located, so please keep in mind what I said before about our after-hours clinic next to Life Labs and Ben's Pharmacy. Another service that we provided before the pandemic was group education sessions, and we used to do these in person, where I would meet with a group of people, as many as 10 to 20 at a time, for an hour-long session to talk about how to make choices that keep you well over the long run. We will be starting these education sessions again later this year, and they will now be run through Zoom. Please keep tabs on our website to find out more about these sessions. But in short, they will be focused on how to use food and other lifestyle measures to prevent and deal with diabetes, weight gain, high blood pressure, heart disease, and fatty liver. There will also be group education sessions for those of you between the ages of 50 and 75, a separate group for men and for women, to talk about things like cancer screening, bone density testing, and other measures that we can offer to help keep you well as you get older. The sessions will be interactive, and I am sure you will find them helpful. I see the services that my team and I provide as being primarily a resource for you to get well and stay well through whatever medical issues you encounter throughout your life. That means I will do my best not to tell you what to do, but rather to help you understand what is going on and present you with options and next steps that make sense for you on your medical journey. Finally, if you live within a 10 to 15 minute driving distance, and for medical reasons you are unable to come into the office to be seen, I do perform house calls on a limited basis. Not all medical problems can best be addressed on a house call, but this is one more way that we can offer you help. Again, before I come out on a house call, we will usually need to plan that visit by phone. Thanks for taking the time to watch this video, and I hope you have found it helpful. If you do join this practice, I look forward to meeting you soon. But please make sure to follow the instructions that you have been provided to properly enroll with the office. We do only look after patients on our roster, so it is really important that you make sure that you are formally enrolled before reaching out for help. Thanks again for your interest. Take care and have a nice day. For future reference, this video has been updated and recorded in June 2022. I hope you found this video helpful. I'm Dr. Dharssi, and I want to empower you to take your health in your own hands, with just enough medicine.